Hello everyone, I'm very excited to welcome you once again to Talking Health with Dr. Laz. It's your favorite health program on television. We are reaching you on your channel of choice, the Africa Independent Television, AIT. My name is Dr. Laz Eze. July 11 every year is celebrated as the World Population Day. Established in 1989 by the United Nations, the World Population Day seeks to focus attention on the urgency and the importance of population issues. The theme of the World Population Day in 2020 was putting the brakes on COVID-19, how to safeguard the health and rights of women and girls now. What does it mean to us here in Nigeria? Let me share some quick facts with you. Nigeria currently has the 7th largest population in the world, with a population of more than 200 million people. And it's been estimated by the United Nations that by 2050, if our population continues to grow at the current rate, we are going to be the 3rd largest country in the world with a population of more than 400 million people, and that will be more than the population of the United States and Brazil. Also, it's important for us to know that our population growth rate is currently 2.2%. This is according to the National Demographic and Health Survey 2018 studies, and is faster than our economic growth rate. Our GDP in first quarter of 2020 was 1.87%. So it means that our population is growing much faster than our economy. It's also important for us to know that family planning or child spacing is a veritable practice for population control and also safeguarding the health of women and girls. What does this mean to us here in Nigeria? Why is family planning important? What are the common types of family planning and methods of family planning that are commonly used in Nigeria? How has COVID-19 pandemic affected the delivery of family planning services? Right after the break, I'll be talking to Dr. Teddy Agida, a consultant obstetrician and gynecologist. I'll be seeking answers from him on all these questions I've asked. Please don't forget to join us across our social media platforms at Talk Health Niger on Twitter, Facebook, and Instagram, or on YouTube, Talk Health Niger TV. And feel free to share your views, opinions, and thoughts both during and after the program. Do stay with us. We'll be right back after this break. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. I'll be taking you to the University of Abuja Teaching Hospital, where I'll be speaking with a specialist, an obstetrician. An obstetrician is a health specialist that deals with pregnancy-related issues among women. He's also a gynecologist. A gynecologist is also a health specialist that deals with any health condition affecting the woman's reproductive organ. Dr. Teddy Agida is the head of the Department of Obstetrics and Gynecology at the University of Abuja Teaching Hospital. And I spoke with him recently on some of the issues, and he'll be providing answers at the University of Abuja Teaching Hospital. Please stay with us as we speak to Dr. Teddy Agida. Thank you very much, Dr. Teddy Agida, for agreeing to join us on this show. The World Population Day talks a lot about family planning commodities for women and girls, and we think a lot of Nigerians need to know more about family planning, what it means, and why it's important, especially for women in reproductive age. So, to a layman, kindly explain what family planning means?
Well, thank you very much. It's my pleasure being on this program because any opportunity we have to enlighten the public about family planning or reproductive health in general, it's always our pleasure to do that. Now, talking about family planning, if you want to know what family planning, putting it in the layman's language, we'll say family planning is the ability of a couple or individuals, all right, to determine the number of children they want to have. All right, not only determine the timing of when to have such children and how the children are spaced. These are the key things that family planning addresses. All right, determine the number of children, how many children the couple want to have, or an individual want to have, as case may be, and how these children are spaced. All right, and then of course the timing of when to have them. These are very, very important.
Thank you, sir, for that simple explanation of what family planning means. Why would anyone want to do family planning? What are the benefits of family planning to the families and to the society?
Now, if we say family planning is to determine or to regulate the number of children we will have, either a couple want to have or an individual wants to have, we look at advantages of family planning from different angles. Number one, you look at the individuals, all right? In a family, if you talk of a family now, you talk of the parents, mother, father, then you talk about the children. That is talking about core family now. And family units make up the society. So if you're talking about advantages, okay, of family planning, you look at it from advantages from the level of the children, the parents, that's both mother and father, and then of course that's the families in general, and of course by extension to the society. Now let's look at it one by one. To the mother, all right, we're talking about determining how many children the woman should have. The more children a woman has, the more it tells on her health. All right. For example, we said if a woman, the ideal thing according to the World Health Organization is that a woman should space deliveries or pregnancies, nothing less than 2 years. Because if a woman gets pregnant, all right, now delivers now, and in the next 6 months or 1 year, which is very common with our community or society, gets pregnant, it does not allow the body of the woman to recover from the effect of the previous pregnancy. If you look at it from the health perspective, okay, we say by the time a woman has up to 5 or more children, that is too much, getting too much. That's what we call grand mortality. So having up to 5 and above means the woman has had too many children, okay, and that will have effect on the health of the woman.
So that after the 5th child, any pregnancy have more.
Yes, even as much as possible, because if we say up to 5 and above is excessive, then it means it's advisable as much as possible that the woman should not even have up to 5.
Okay.
That means up to 4, yes. So, that is talking of number now.
Yes.
So getting up to 5 and above, that means it's too much. That's what we call grand mortality. So that's talking about the number now. Now talking about the timing as it affects the health of the woman. All right. Now we said in our environment, of course, in our environment here, the age of adults also is taken as 18 years and above. All right. So, and WHO defines up to 19 years as the age of adolescence, so, or teenagers, so to say. All right. But from the health angle, we say any pregnancy below the age of 18 is not healthy for the woman, because the body, the girl child is still growing, is still getting matured, a lot of things are still happening, within her body. So the body may not be adequately prepared for that task. All right, below the, so we say the woman should wait until above the age of 18 before she gets pregnant. Now, on the other hand, all right, okay, we say above a woman 35 years and above, it's also not healthy for a woman to get pregnant, because as a woman is advancing in age, a lot of things come with age. Yes, all right, because of age factor and other comorbidities, other things like hypertension and other things may be more common. So we say above 35 and above is not healthy. All right, so that's talking about the timing now. And of course, talking about timing again, sometimes some women have some problems, medical condition, and we just say, well, it is not, with this medical condition should be taken care of first before the woman gets pregnant. In other words, timing again matters there. All right, and you need family planning, all right, for that timing to be appropriate. All right, so that's talking about timing now. Right, then I've told you about duration in between pregnancies. The WHO says pregnancies should not occur less than 2 years apart. If it is less than 2 years apart, it's too frequent, and that will have to tell on the head of the woman, because the body of the woman does not have enough time, adequate time, to recover from the effect of the previous pregnancy.
Thank you once again, Dr. Agida, for taking time to educate our viewers on what family planning means, the benefits, and why it's important, especially for women and girls in a productive age group. So, do they have side effects? And if yes, what are those side effects that people need to know about?
Yes, the body needs to recover. In that case, the body does not recover very fast. Very well before the next pregnancy. And one of the problems is that the woman may have what we call anemia. All right, that means the low blood level, putting it in the layman's language. All right, because the body does not have enough, does not have enough time to recover. That's one common thing that will have effect that mother will come down with. Now, if you look at the other system, all right, it can also weigh down on the cardiovascular system of the woman. There are a lot of changes that occur in the body of the woman, involving, let's say, the circulation, all right, the heart, what we call cardiovascular system. So when the woman is having too frequent, pregnancies like that, the cardiovascular system may also be weighed down. And you notice that the woman may be prone to, with age factor, hypertension, and all of those other things. All right. So those are some of the morbidities. Okay. So now that is advantage of family planning for the mother. Now the children, for example, the less children the couple has, the better for them, because the couple can provide more for them. But when you have so many children, all right, talk of how to train them in school, talk of how to feed them, all right, all this will be a problem.
What about those that have money to take care of as many children as they want to have?
Yes, you may have the money to take care of them, but it has also been shown that for example, if a woman, when pregnancy occurs too frequently, all right, it also has effect on the unborn child. Either the child may not grow very well, what we call intrauterine growth restriction, okay, or such a woman may be prone to miscarriages, when pregnancies occur too close together, all right. And so it is not just only the ability of, it's not just having the money to take care of them when they are born. Yes, you may have the money, but just like it has effect on the health of the mother, when pregnancies are too close, it also has effect on the unborn child. You have the miscarriages, preterm deliveries, all those things.
Welcome back to Talking Health with Dr. Laz. I'm still speaking with Dr. Teddy Agida. He's the Head of Department of Obstetrics and Gynecology at the University of Abuja Teaching Hospital. He's been speaking to us about what family planning means and how it's important to the mother, to the child, and to the society. So he's now going to show us some of the family planning methods. He will talk to us about them, some of the tools that are being used. For some of you may be hearing about it, but you may not have seen it before. So we are going to be looking at them, and he's going to be telling us the name, the use, the potential side effects, and other things. Thank you, Dr. Agida, and it's very good to have all this on the table. So in family planning, there's the barrier method and the non-barrier method, the reversible and the irreversible method, the short-term and the long-acting methods. So we have all these. Please tell us more about them.
Well, thank you very much. You started well by trying to classify them. The family planning methods, or what we call these are contraceptive.
Okay.
Contraceptive methods. The means by which you achieve family planning is by the use of contraceptives. All right. Now, just like you say, we classify contraceptive, by different methods. All right. In terms of barrier, non-barrier method.
So which one is the barrier method?
So when you're talking about barrier method, just like placing a barrier between you and somebody.
Okay.
Right? So placing a barrier. Now, if you talk of barrier method, now you talk of the condom. This is the male condom.
Male condom. Okay.
Right? It's a barrier method. Now, this is a female condom. Of course, it's open already. We use it for demonstration.
Not many people know that there's a female condom.
Yes, like I say, this is open. We use this for demonstration. So I can.
You want to open it?
So I can touch it because it's not clean. Now, this is an example of the female condom.
Okay.
All right. So the woman holds this area, pushes it into, her private parts,
okay,
and then this place is open.
Yes,
right, to cover the external part of the female genital tract. So that's female condom. Like you said, a lot of people they might not be aware, or even they are aware, they might not have
seen it. Yes.
Now, like I said, this is male condom. So this one, when they are used, they create barrier. That has barrier between the male organ and the female organ.
Okay.
All right. So that's what it's called barrier method. There are other types of barrier method which we don't have here, like the cervical cup, the diaphragm. Unfortunately, I would have brought a diagnostic sketch, to show you if you don't have them here.
Okay.
All right. Now, the cervical cup, just like the name entails, it covers the cervix.
The opening of the womb.
Yes, the cervix, the part that projects into the vaginal portion. All right.
Okay.
And then the diaphragm, and then, so there are other barrier methods which we don't have here. So we can say barrier method and non-barrier method. That means the other ones that don't create barrier between the male organ and female organ and non-barrier methods. All right, and we'll come to that. All right. Now the other way, yes, for example, the non-barrier methods can be classified, by various means. All right.
Some people complain that when they use this, they get fatter, and is there everyone that uses this, or there are some indications on the use?
There is what we call WHO, World Health Organization, medical eligibility criteria.
Okay.
That means there are criteria that you put into consideration. That's why before we give this to the patient has to undergo what we call counseling.
Okay.
You tell the client about the different types of different methods you have, all right, the side effect, and then not only that, you are going to examine the woman.
Okay.
All right.
So what that means is you do not just buy this and begin to take.
No, it's better.
Your doctor will know which one that works.
Or a family planning provider.
Okay, provider which can be a nurse or a health worker.
Right, because you are counseled to choose a method. Okay. And when you choose a method, you have to be examined. We have to interview you to find out whether you have conditions that may not be favorable for you to use the method you have chosen.
Okay, so that our viewers get it very clear. These are different methods. This one, okay, is
now
an
this is what we call
implant
on what we call yes, this is an implant. An implant is one rod. Unfortunately, is sterile inside, so
okay,
I can't bring it
out.
But I can show you.
If you bring it out, it gets contaminated, and we can't use
now,
it.
Now, this is implant on. This is jade. Jade has two rods.
So they put this on the skin?
They put it, yes, at the upper part of the arm here.
Okay.
Or under the skin. These are different contraceptive device. This is IUCD.
IUCD. Okay.
Yes. This is what we call IUCD. Okay, if you look at it like a T form, it's not the whole thing that enters into the no.
Okay.
If you look at it, yes, if you look at it very well, just this, this is like, look like a T piece. All right, from here, this is the here to here.
Okay.
If you look at it, that is just what this. All these ones are things we use to introduce.
Okay.
This short word.
Does it get to the womb?
Yeah, we put it right inside the womb.
Okay.
But some people have this misconception or that if you push it, it will disappear very quickly. No, it is not just so that you insert it into the womb and it is placed there.
Okay.
Right?
How long does it last?
It lasts for 10 years.
10 good years.
Yes.
Okay. Well, right. So can someone decide? Okay, I don't want to continue. Let me take it out.
Of course. When we counsel you for family planning, even when you make a choice and we provide that, that's what we call post insertion counseling. Then this one, unfortunately, I can't open it. This is called Sayana Press. All right.
So
okay, it comes. Yes, it comes in this already made container. Okay. Which or injection, what we call a microjet. Okay. Which is that one is injected what we call just under the skin.
Okay.
So right. And this and this is for also 3 months.
Okay.
All right. So these are some of the family planning methods.
Thank you very much. I'm very sure many of us are seeing this for the first time. Yes, almost everybody may have seen this, but not same for all these other tools. Some might be looking scary, but don't mind. Like Dr. Agida explained, all these things doesn't get into the body. So the things that get there are just what is required. We feel it's important for us to see and to know that they are reversible, except the ones where the womb is tied and where the varicocelectomy and other, that one is taken out from the map. But all these, when you don't want to have pregnancy, you use it. When you change your mind, you also go and it's reversed. And I know that this works. So thank you so much, Dr. Agida, for your time having to educate us on all this. I would believe that all those that listen would have learned one or two things. So you keep your questions coming in through our various social media handles and let the conversation continue. We'll provide answers to you on any component. And the conversation on family planning and use of contraception is still going to continue because we need to look more at the policy aspect of it. Why are Nigerians who need this family planning, why are they not having it? Thank you for staying with us up to this point. That's the much we can take today, and we thank Dr. Agida for joining us on the show. I believe you learned something new about family planning, the various methods, and why it is important. The conversation is going to continue on our various social media handles, which are displayed on your screen, on Twitter, Facebook, and Instagram. Follow us at Talk Health Niger, as well as Talk Health Niger TV on YouTube. Feel free to share your opinions and questions. We are going to see you again on Africa Independent Television on same day, same time next week. Thanks and bye for now.